Hi, my name's Phil. I like talking about politics, and I wasn't going to do another one of these videos, at least not just yet, as I set out the challenges for the Department for Education and for schools and colleges in getting schools and colleges reopened a couple of weeks ago. However, there have been a couple of scientific studies that sort of work against each other, really, that are muddying the waters, and the papers are going absolutely mad with it as well. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So there are two things to talk about here, really. First, there's the political arguments, which I have to say the teaching unions are making a right arse of. And then there's the scientific arguments, where there's also a big pull in opposite directions. So the political heat has been turned up. Depending on which papers you read, it's either the teaching unions that are point blank refusing to work with the government, or the government are sacrificing more lives to get kids into school so that people don't have childcare excuses for not working. The political fire then had petrol poured on it by the Education Secretary, Gavin Williamson, as he suggested that teachers were not doing their duty, in the same way, presumably, that the Health Secretary, Matt Hancock, blames NHS workers for the PPE shortages. In reality, when it comes to which side has the point, it's sort of both. The largest teaching union, of which I'm a member, the NEU, have made a right balls up of the PR side of this argument. They are arguing, or at least they were, I think they've sort of relaxed their language a little bit, that it's just not safe to reopen schools and so it shouldn't happen. That is a stupid position to take and makes it way too easy for the right-wing media to press the attack. After all, some other countries have got schools open to varying degrees, so the argument will go there must be safe ways to do it. And by the way, some of the countries that have opened up their schools at least partially are not headbanger countries like ours. In addition, there's this study from Iceland suggesting that small children are much less susceptible to the illness, and also they are much less likely to pass it on to their parents, and therefore having groups of them together isn't necessarily as risky as you might imagine. Now, certain sections of the media are pointing this out as absolute proof that we're all making a fuss about nothing in opposing the reopening of schools. And the teaching unions, especially the NEU, have made this trap really easy to walk into. They shouldn't have opposed the reopening. They should have said how keen they were to get schools open again, as many of their members are. I have to say, a lot of teachers understand the damage that has been done, because we know, people reading a newspaper and not necessarily involved in schools, even if you're a parent, do not necessarily understand. You may be a parent of a child that's getting access to their remote learning, and you may think this isn't as good as being in class. No, it's country mile away from that. But you're not really seeing the major damage, because we as teachers are, because there are some kids not engaging with it. It may not be their fault, it may be, but it may not be. There's all sorts of difficulties in some of these kids accessing that learning, which means there's loads and loads of kids not really getting much of an education at the moment, and so we would love to work with the government on achieving some sort of reopening of schools, at the very least for the more vulnerable kids. The onus should be on the government to come up with a plan to do so, because the fact of the matter is that the Department for Education have not come up with a plan to safely reopen schools and colleges. I keep an eye on the DfE guidance daily, not just as part of being this, but as part of being a teacher, albeit very, very part-time now. And there's been nothing. This allows the media to distract the public with stories of cowardly teachers or obstructive unions, when they should be pointing out that the government haven't actually said how schools are supposed to open. What measures should we be putting in place? They just want it to happen as if by magic. And all that's changed from the government over the past week, since Boris Johnson announced these wonderful things, is that the government now say that the risks are much smaller to young children because they're less susceptible. But there's no actual guidance. There's also no mention in their releases on what they are basing this statement about the susceptibility of children on. I can guess, but I don't know, because they've not said. And they've also not said what they think the risks are for staff. That's completely absent from the guidance. Completely absent. And this notion of children being less susceptible does have a few question marks over it. It is very likely based on this Icelandic study. And sure enough, Iceland tests a lot. Absolutely. It's per capita testing right out there. Way, way higher than ours. But the thing is that children are not tested as much as adults, because even in Iceland, you only test when you need a test. They're not testing everyone in the country every few days or something like that. It's just that when people need a test, they get one. But children generally don't, because we do believe that children are less susceptible to developing symptoms, at least. That doesn't necessarily follow that we understand a mechanism for them being less infectious somehow. But the idea that they do suffer generally milder symptoms, which means they are much less likely to be tested. So drawing conclusions about the transmission of the disease from children is tricky. A study can say, well, we haven't really seen any evidence of this. But remember, absence of evidence is not evidence of absence. But it is an interesting avenue of study. Second, it's not just children going back to school, it's staff. Some of them will be getting on a bit. Some of them have underlying health conditions. Some children will also live with parents or others that are similarly vulnerable. Likewise, some teachers will live with people who are similarly vulnerable. Third is the small matter of the COVID-related inflammatory illness that seems to be affecting young children. This hasn't been a thing in Iceland, but it has been in the UK, as well as a few other countries, and it's pretty worrying. Now, I'm not going to go into much detail. If you want to read a bit around it, it's called Pediatric Inflammatory Multisystem Syndrome, or PIMS for short, but not the sort of PIMS that people really like to have at summer. And there are an increasing number of cases being identified. And if you get this wrong, we're going to see cases of this massively explode, and we'd all want to avoid that. Finally, the British Medical Association has said that schools are not currently in a position to be safely reopened. But the way the narrative needs to be controlled is not about whether schools should or should not reopen. We absolutely should be moving towards a position where they can. We can't just say, let's wait for a vaccine. We don't even know we'll get a vaccine. We hope we do. We don't know we will. We don't know when it will be if we do. We have to be thinking of transitioning to a normal way of life without it. That has to be a priority. And it's not just about childcare for workers either. The education of the kids themselves is suffering. Of course, we need to be able to limit that damage as much as possible. We've already exposed ourselves in Britain to dumbasses. We don't need to breed a generation of even more dim-witted citizens, quite frankly. I would be less worried if I thought that at least parents were encouraging their kids to read more whilst at home, fiction and non-fiction. But it ain't happening on a large scale, I know that much. So the conversation has to be about waiting for the government to come up with a plan. No need to argue against reopening. No need at all. The law already states that all workplaces have to minimise health and safety risk to workers. So there's no way of legally returning, because to reopen a school you need staff. Staff cannot go and work under normal teaching conditions because it's not safe to do so. It would be illegal for a school to reopen like that. So there has to be something in place, and it's the government's job to work with schools and colleges to develop that something. And the sooner the spotlight is put on that, the sooner the government might actually seriously do something about it. Because at the moment, the government, it's quite clear that the government under Boris Johnson do nothing unless they have to. Lazy sons of bitches. Sorry, they are. And, at the moment, the argument is about the teachers, and it shouldn't be. It should be about the government. I mean, maybe they can repurpose those Nightingale hospitals, which they never intended to actually treat patients, as larger space schools, and persuade some educated furloughed workers to go in and help teach as well to cover staff shortages. Or maybe we should get Jacob Rees-Mogg to go in and teach inner city schools densely packed into classrooms, see how far he gets. But on another note, so Eton was trending yesterday on Twitter. I thought, I've got to have a look at this. For those who don't know, this is a very expensive private school in the UK that makes a habit of educating future prime ministers. And Eton has insisted that there's no way it's opening next month. It's like, you're having a laugh, aren't you? They say they will not open until at least September at the earliest. And when they do open, every child will be tested. So no problem then. If the Prime Minister's old school thinks that that's the way to safely reopen, then just extend the same policy to all schools in the UK. Problem solved. And while you're at it, make sure that the density of kids in the classrooms is on par with Eton as well. But on a more serious note, on that issue of testing, I can't understand why people don't seem to be talking about an obvious way to safely open schools again. I say obvious if you go along with government thinking. So if we have an antibody test that is 100% accurate, and if this would indicate that you are safe from the infection, and I accept that second one is a big if because there is no proof that that is the case, but the government behave as if both of those ifs were true. So in that case, why not instigate a testing regime and go ahead with this, passport idea, and only allow teachers and children who pass it to go into the schools? Especially if they insist that basically 30% of the population and rising are immune anyway, should be decent odds for getting quite a few people safely back to school, wouldn't it? Now, as I said, I don't necessarily think that is a cast iron solution because I do not necessarily think that the things the government say they believe are actually true. But they do, so why aren't they proposing this as a solution? But those are my thoughts anyway. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.